Getting pregnant at 45. My wife is 45. We have been trying to get pregnant. It's not happening. Please help us. What should we do? I welcome you to Tochi Fertility Channel. If you like this kind of content, kindly follow us, like, subscribe. You guys should subscribe to support this platform anywhere you are watching this video from. So I have been making videos about getting pregnant at 40, but this time around it's like a lot of people are 45 and they are still wondering if they can still become pregnant. Yeah, and I went into research. My findings is what I'm here to discuss with you. But before we do that, let me put a disclaimer. Like you all know, myself, Tochi, the owner of this platform, I am not a fertility expert. I am not a medical practitioner. I am a researcher. I study already concluded research is about fertility, and I created all this platform to educate, sanitize, enlighten, inform, to give general information to women that are trying to conceive. If you need help, prescription, recommendation, or you need someone to answer your question, please, I will encourage you to contact your healthcare provider, your gynecologist, or your fertility expert. And this content is just for general information only and must not be used as a basic for any patient treatment. Please take note of that. Now, if you have been following me, most of you don't watch my videos. You only look at the title. Maybe you watch for a few seconds and you go. But I'm assuming I'm gossiping. You will settle down to share the gossip that cannot, add any value to your life. But this particular video that will add value to your life, you wouldn't watch it. I don't know why it is like that. So I will start by this. Pregnancy at 40 and 45. Now start like this. Every woman is born with a fixed egg. And remember, these eggs, they don't increase, rather they decrease. So up to 1 million to 2 million eggs, and every day you lose 35 immature eggs. Now by the time you get to puberty, it's only 30-something thousand that may be remaining. Now you are just puberty. By the time you get to 30 and 35, you might have about 100,000 remaining. Now when you get to 40, 20,000. Now 25. Can you help me to calculate this? So what am I trying to point out here? Age have very important role to play when it comes to getting pregnant. That is why I always advise, if you're a woman that want to have family, what I mean by that, you want to have children, I advise you to start your family early. Starting up your family do not prevent you from attaining to your goal. I know it may limit you, but if you want to become something, you can still become what you want. I have seen many people who married after their secondary school and they still become what they want to become. It depends on how you carry yourself, how serious you are. So stop seeing childbearing as a limit to your goals or something like that. You can have so time. Maybe I bring 2 or 3 or 4 years to, give birth, to raise my children. Then I will continue what I'm doing. So age plays very important role. As you are aging, all the organs in your body, especially your ovaries, they also age, and your eggs diminish. For you to become pregnant, there must be an egg that your husband's semen will fertilize. Now, if you are not releasing egg, in fact, the reason why you are not getting pregnant, the 88% reason why you are not getting pregnant is because you are not ovulate, you are not releasing an egg. I know that there are other issues, but the lack of ovulation is one of the problems that make most of women not to become pregnant. Pregnancy after 45 years is infrequency, and the mother and the baby should be considered as a risk because there is greater incidence of spontaneous abortion, gestational disease, and chromosomal abnormality in the fetus. So because you are getting old now, in the Western world, I'm going to be using Germany for example, If you are 40 years and you become pregnant, they are going to take absolutely care of you. They are going to monitor you as the pregnancy develops. They are going to make sure that you carry a healthy pregnancy and give birth to a healthy baby. Now, what about those in other countries that are not developed? By the way, let me answer this question. Somebody say his wife is 45. Can she still become pregnant? Of course. If she do not have any health issue or any fertility challenges, of course she will. She will become. But the another thing is, can she carry to the end? Some people are so lucky. Some people are so lucky, I will put it that way, that they may be 45, 46, 47, they will still carry pregnancy like 20 years old girls. Our body differs. Everybody is unique in their own nature. You cannot, because of somebody is 46 and she carry pregnancy, you think that it will happen the same way to you. Yes, you can. But what we are looking at here, you heard it, that pregnancy at 45 is considered as a risk because there is many things. This time around, your hormone have scattered, your muscles, your strength, everything, even your belly don't weak. So I use myself as an example. When I have my first and second issues, I was about 20, under 20s, and the last one under 30s, it was, the experience is not the same. Your muscle is going down. I was like, is it not this pregnancy that I will have after 3 months? I'll be doing what I'm doing. What is happening? A lot of things changed, let alone somebody who is 45. And children need strength. That is the reason why you need to start up your family early. Children, for you to train children, you need energy. Talking, shouting. If you see the way I talk each day, you will have mercy on me. It's just like a woman that gives birth at the age of 64. Yeah, it's a very joyful thing, but the strength to be keeping awake at night is not easy. I always tell people that it's not all about becoming pregnant, carrying the pregnancy, giving birth. The real work starts after giving birth. That is when the real work starts, when your energy is needed, when your attention is needed, when your strength to speak is needed. So what am I trying to say here? Being 40, 45 doesn't mean that you cannot become pregnant as long as you are seeing your monthly flow, as long as you still ovulate. Of course you will, but you need to be placed under a very careful thing so that you don't have, because at even 40, a lot of women at 40, a lot of women develop chromosomal abnormalities. So before you start planning to get pregnant at 45 or 40, 35, make sure you conduct hormonal tests and make sure that you are being watched. Follow your doctors, speak with your gynecologist, and you will see everything will be okay. I believe you enjoyed this video. If you do, you guys should subscribe to support us, and God will bless you.